I acknowledge the presence in the gallery of the Honourable Joan Hall, former Minister and Member of the Lower House. The Honourable Ms Franks.
Mr President, I seek leave to make a brief explanation before addressing a question on the topic of health buildings in Ceduna to the Minister for Health and Wellbeing.
Is leave granted? Leave is granted. The Honourable Ms Franks.
Thank you, Mr President. Last month, concerns were raised by the Yadu Health Aboriginal Corporation in Ceduna from that Aboriginal community-controlled organisation's leaders regarding their health clinic. They stated that their 50-year-old building had already reached the end of its life and now posed a safety threat for patients and staff alike. Indeed, the Yadu Health Aboriginal Community Corporation in Ceduna say that between 30 to 40% of the building from which it operates has been deemed unsafe due to water damage, asbestos and mould. It's been described as catastrophic damage by Senator Mariel Smith, and not to be partisan about this, it's been described as beyond redemption by the Liberal Federal Member for Grey. My question to the South Australian Minister is, what actions has South Australian Health taken on this issue? And I understand that a survey was done and reported to InDaily that there wasn't a problem. What was the status of that survey, and why did it not find mould, asbestos and water damage to be a danger to those patients and staff?
So for Health and Wellbeing has the call.
I thank the honourable member for her question, and I note that it's a primary question. In an earlier session, another member thought that was supplementary on a completely irrelevant matter. In relation to the Yadu facilities, I agree with you that they are unacceptable, and I know that because I've toured them. On the 27th of April 2021, I toured the facility, and it certainly is ripe for redevelopment. I think it's important to appreciate that the Yadu Health Aboriginal Corporation is an Aboriginal community-controlled health service, and it's funded through the Indigenous Australians Health Program. It receives more than 70% of its funding from the Commonwealth Government. SA Health currently provides facilities for the operation of the Yadu Health Aboriginal Corporation. It's on the same grounds as the Ceduna Health Service. Yadu is seeking assistance to cover the costs associated with the demolition of the existing building and building a new bespoke health centre which will provide greater care for clients in the community. The Yadu has previously applied for grants to construct a new building. However, they haven't been successful, and one of the factors in the past has been the lack of security of the title to the land. So I'm proud of the fact that, that it's this government that dealt with that long-standing issue, and the grant of a 99-year lease to the land has now been finalised, which will assist the organisation in attracting funding to replace the building. And I too would hope that the Commonwealth Government would favourably consider grant applications.
Supplementary, the Leader of the Opposition.
When the Minister says the 99-year lease has been finalised, is that finalised in South Australia Health's point of view, or has that been accepted and executed with Yadu Health?
The Minister has the call.
I'll seek the current status. I thought that it had been completely finalised, but I'll certainly clarify that.
The Honourable Ms Franks has supplementary.
In my question, I asked why SA Health had said that the building was fit to live in. The Minister, actually, having toured the building, has disagreed with that assessment. So my question, though, was to what assessment did SA Health undertake to provide that commentary to media?
Minister.
Sorry, what was the phrase again?
It was reported in InDaily where SA Health actually said that it can be safely occupied and there are no serious health risks.
Minister.
Sorry, well, I suspect that is true. The fact that it if you like continues to be safely occupied doesn't mean it's not right for redevelopment. My recollection from my visit is that significant parts of the building have actually been decommissioned in the sense that they're not occupied. So parts of the building are occupied, but I don't believe that the facility is a suitable long-term home for a key partner to a vulnerable community. Some of the issues that I understand the current building has is it has a deteriorating roof. Regularly there are ceiling collapses, and there's also issues with asbestos and ageing mechanical and electrical plants. So I'm certainly not aware of any voice within SA Health that's saying to me that this building doesn't need to be redeveloped.
Supplementary to Leader.
Is the Minister aware, or has his department done any work as to what the cost would be to the state health system should Yadu Health stop providing services that I believe are provided to somewhere around 4,000 people a year, and with somewhere in the order of 70 staff from that facility? What would it cost the SA Health system if that failed?
Call.
I certainly don't see how that is supplementary to my original answer.
You've asked the question. Order. Order. The Minister's on his feet.
But let's be clear, SA Health has been a long and strong partner with Yadu, and we look forward to that continuing.